Hi, everyone. This is Janet Hill at the Rock Island County Health Department. Thank you for joining us. It is 4 o'clock on April 28th, and today we have with us Nita Ludwig. She is the administrator of the Rock Island County Health Department. We also have Amy Thoreson, the director of the Scott County Health Department. We also have some business leaders on our call today. We have Zach Waters, who is the safety manager of John Deere Davenport Works, and Trisha Taylor, who is the Human Resources Director of Sears Manufacturing. Let's first of all start off with some numbers. Nita, will you start us off, please?
Sure. Today in Rock Island County, we do have 9 new cases of COVID-19, and that brings our total to date to 14,262 cases. We currently have 25 people hospitalized in Rock Island County with COVID-19. And unfortunately, we do have a death to report today, a woman in her 80s who had been hospitalized. And we offer our sincerest condolences to the family of this person. That does bring our total deaths in Rock Island County to 313.
In Scott County, we've had 20,847 positive tests, and we've dropped to a 6% positivity for the last 7 days. We're at 238 deaths throughout this pandemic. For vaccinations, we have 55,577 fully vaccinated Scott County residents at this time.
Okay, Nita, we'll first hear from you for prepared statements for Rock Island County.
So the number of people vaccinated in Rock Island County is going up quickly. More than 88,000 doses have been given in Rock Island County residents, and almost 39,000 people are fully vaccinated. That's 27% of our residents. We are making a big dent, but we still need your help. The people who have been eager to get vaccinated already have taken advantage of the many options in the Quad Cities. Everyone age 16 and older is now eligible to be vaccinated. We are now at the point where you can decide to get a vaccine and have it in your arm in a matter of minutes. Our healthcare and our pharmacy partners also have many opportunities. The Genesis mass vaccination site at the former Dick's Sporting Goods building on Elmore Avenue in Davenport is taking walk-ins on Tuesday and Thursday from 10 a.m. to 6 p.m. Unity Point Trinity offers vaccination at its urgent care site at Duck Creek Plaza in Bettendorf, and you can visit their website at unitypoint.org or call 309-779-7979 to get scheduled. Community Healthcare is offering vaccines to everyone and can schedule larger groups for on-site clinics. Please visit their website at chcqca.org. Walgreens, Walmart, CVS, Hy-Vee, and Jewel Osco pharmacies all have availability too. Please visit their websites to make an appointment with one of those pharmacies. Vaccine supply is plentiful. Your shot is now. We have many open appointments at our Camden Center site in Milan. We offered several walk-in hours today, and Thursday's hours are all walk-ins too. We will offer both the 1-dose Johnson & Johnson vaccine and either dose 1 or dose 2 of the Moderna vaccine. Appointment times that have already been made will be honored. Most of the time, patients are in and out of the clinic within 20 minutes. It couldn't be any easier. In the last week, many of our middle of the day appointments have gone unfilled, which is why we are trying a full day of walk-in appointments tomorrow. Appointment times, of course, will also be honored. We will update you on our plans as they evolve. Starting next week, the Rock Island County Health Department's National Guard assisted vaccination site will change hours to Tuesday through Saturday and be closed on Mondays. The hours will remain 8 a.m. to 4 p.m. Please take care of yourself and your community by getting your vaccine as soon as possible. Let's end this pandemic. Thank you.
As Nita mentioned, the vaccine supply coming into Scott County and Rock Island County has increased dramatically since the beginning of January. We're to the point of supply being plentiful. And to repeat one more time, so there is no confusion, vaccine is now available to everyone age 16 and older. There are no priority groups to wait for, no one else standing in front of you in line. It's your turn and we need you. A vaccine is not just an individual solution, it is a community solution. While your vaccine might prevent you from getting sick, your vaccine by itself doesn't keep the virus from spreading around the community. Having lots of people vaccinated is the only thing that will slow it down. If a virus can't find unvaccinated people to jump to, it becomes weak. When it's weak, it can no longer spread. That is our goal. That is what the COVID-19 vaccines can do for us if we all do our part and get vaccinated. COVID-19 has forced nearly every person in our community to make choices they normally wouldn't have to make. From canceling holiday family gatherings to getting takeout or eating outdoors instead of sitting close together in a restaurant. The most recent decision has been whether or not to get vaccinated. I know that scientists have not been able to answer every question about the vaccine, but they have answered the questions that say, right now, we have safe, effective vaccines that are preventing people from getting very ill and getting hospitalized from the virus that is here, circulating now, and not willing to wait on us. We have seen a dramatic decrease in the number of individuals over 65 that are testing positive. The likely reason, 77.6% of Scott County residents 65 and over are fully vaccinated. They made the choice to start turning this around and to get back to their normal lives. We know that businesses and employers in our community are also weighing their options when it comes to vaccinations. Yes, vaccines are now readily available from healthcare providers and pharmacies, but many in our community still haven't grabbed at the chance to become vaccinated. Some need the extra push or assistance with taking the next step. A vaccinated workforce is a healthier and more reliable workforce. And being flexible to assist an employee with going to a vaccine appointment costs much less than the financial and workload challenges that come from an employee needing to miss work for multiple days of isolation or quarantine. Sometimes even the smallest of incentives can make the difference in an employee choosing to vaccinate or not. We are joined today by representatives of our business community that have had tough conversations about the health and safety of their workforce during this pandemic. Thank you for your willingness to share your story.
Thank you. First, we're going to hear from Zach Waters, the safety manager with John Deere Davenport Works. So Zach, we'll let you go ahead and unmute and get started. Thank you.
Okay. So I guess I would start by just briefly talking about how COVID impacted us when we going back over a year ago. As we started working on this, we were reaching out to local health departments in the community, in the different counties, understanding what our role was, how we were going to communicate positive cases through multiple steps. Temperature screening, masks, social distancing aspects. Getting through the hurdles of mandatory illness reporting and tracking that as an employer in the area, a large employer. We also became very familiar with the position it put us in for cross-training employees in the events of absences with illness, and just sorting out all of these different aspects with COVID. So it moved really quickly, and it was very exciting for us to have an opportunity. And there was a lot of conversations end of January, early February about the potential to have an opportunity to vaccinate our employees and what that would look like and how that may change the game in a positive way. from an absence perspective, but more importantly, from a health perspective, how could we change that with not only within our facility, but within the community and do our part. And so I think some of the large appeal here at Davenport Works, as our team was talking about it, vaccine clinic on site would provide an opportunity to get a large percentage of our employees vaccinated, and it would come at a large convenience to those employees. And from an orchestra, in order to orchestrate that, we would also be coordinating a single event. And so it was exciting, and it was exciting to work through that. So on March 12th, we partnered with Hy-Vee, and we were able to do the first dose of vaccine. And then on April 1st, we followed up with the second shot for the vaccine that we received. It's made a huge impact. I think it's made folks that were uncomfortable coming to work because of pre-existing health conditions. It allowed them to come back, re-enter the workforce. And I think it was the step that we needed to have employees more comfortable as we move into what the new normal looks like with all the social distancing, disinfecting as we continue to do some of those items and review other items. The vaccine has given us kind of a turning point to become more comfortable in asking questions of what does it look like as we open up. So it's been very beneficial. Our employees, so we had about 40% of our population who participated in the vaccine clinic, and we have an understanding that another large percentage received it in the community. So with Rock Island, some of the discussions that Illinois opened up, there was opportunities for some of our employees across the river. And so there's a large portion that once we offered it, they had already received it. And so again, just a very solid feeling from a health perspective that we have folks that are protected in the workforce. And we know that that's going to help us alleviate workplace transmission of COVID here at Davenport Works.
Thank you so much, Zach. I appreciate all of the thoughts on there and lots of good information that we've been kind of sharing. So appreciate that. We also have Trisha Taylor with us. She is the HR director with Sears Manufacturing. And I know their story is a little different from how things rolled out at a large facility like Davenport Works. And you guys still have a large number of employees, but we appreciate you coming as well and talking about how those conversations took place at Sears and how you worked with your employees.
Sure. So this last year has been trying in a number of ways for so many people. But as an employer, there were occasions when we'd see so many people out that, for days or weeks at a time, that we'd shut production lines down. When vaccinations were first being administered and the conversation really began, most were open to the idea and wanted to know if we could or were going to offer it on site. We really tried to get that, and it just didn't work for us. So we participated in one of the clinics through the Scott County Health Department in early April, and had employees set up appointments, and we had a good turnout. We've set policies and procedures around keeping employees safe during this pandemic, like most employers. We required all employees wear facial coverings all the time, shop or office, even when we're able to social distance. We reduced the number of in-person meetings, or if we had to meet face-to-face, the number of people that could be in a room. We encourage people to stay home if they're sick.
Hey, Trisha.
Alternative, yeah.
Can you scoot up just a little bit? You're cutting out just a tiny bit. I want to make sure that we catch all of it.
Okay. Do you need me to go back at all?
Maybe just a couple sentences, but I apologize.
Okay.
You're in a good rhythm there.
It's because I wrote it down. Well, here, so we set a number of policies and procedures around keeping employees safe. We required all employees wear facial coverings in an office or in the shop, even if we're able to social distance. We've reduced the number of in-person meetings. And if you had to meet face-to-face, at least limited the number of people that could be in a room. We've asked people to stay home if you're sick. We've alternated break times, shift times. We've learned how to work through remote work. The vaccine just offers another layer of protection for our employees. And honestly, we think it's our quickest way back to normal. We've already got employees asking when we can stop wearing the masks. We just keep reminding them to get vaccinated and encourage others to do the same. The more employees we can get vaccinated, the sooner we can start peeling back some of the measures we've taken. Overall, our employees have been very receptive to getting vaccinated. and they've been sharing their experiences with others, hoping to get them on board. We've been lenient during this COVID pandemic with respect to attendance, and we've continued to be lenient if an employee should experience an unpleasant side effect after getting a shot. We would estimate about 1/3 of our workforce has been fully vaccinated, and we're still pushing for people to do it, sending out information when we're aware of clinics or, just sharing what we know.
Thank you, Trisha. I appreciate that as well, and the experience with Sears there. And now we're going to round it off with, we have Paul Rumler. He's the president and CEO of the Quad Cities Chamber. And I know you guys have been a good supporter of our businesses throughout this. And so we appreciate the support you've been providing them regarding vaccinations and the rollouts and how differently they've happened in each state. So thank you for joining us, and we look forward to hearing your message as well.
Thanks, Brooke. Happy to be part of this coalition and join you all today. And it's great to be following two great leaders of our community in Sears Seating and Deere and Company. Thanks for leading the way. Many employers are dealing with exactly what you've dealt with, but going back to a year ago, we know that the employer community wore the brunt of COVID and how we had to do shutdowns and protocols, and we went through a lot. And the team members and employees joined hand in glove to figure this out together. And it was a really tough time. I think we're at that point in time that it's an inflection point where we can begin to improve our workplace settings. And like Trisha said, many employers are talking right now about how do we stop wearing masks? How do we get back to normal? Those are questions that I know employees are asking me in my workplace, and I'm sure that they're happening across the Quad Cities. And the answer is pretty simple and straightforward. It's all in vaccinations. So from the Quad Cities Chamber's perspective, we're encouraging all employers throughout our region to have that dialogue with your team members on a regular basis. Make sure that they know where they can get a vaccination, what the benefits of it are, and if you can do something fun in your workplace or incentivizing your employees to go get a vaccine, we encourage you to do that. That could range from anything from paid time off, just like you might be going to a regular doctor's appointment, to give them that flexibility. I know that many employers in some states, there's a requirement to allow team members to go vote if it's election day. Why don't we treat it in the same way for vaccination day and help get over this barrier towards herd immunity. So we're asking people to be flexible, be creative, and encouraging their team members to get this vaccine, because overall, this is about our health of our community. It's also about the economic health of our community. And we know that the quickest way to a strong economy is going to be through this vaccine. I'll tell you the story that coming into the pandemic, our region was riding a relative high for our economy. Companies were doing great. We were well positioned for more growth. And I think that the quicker that we get to a fully vaccinated community, the faster we can get back to that strong economy. We continue to hear optimism from employers throughout our region that things are looking better. Work orders are improving. The forecast for the next 6 to 9 months is tremendous, could be some of the best times ever. And I hope that they are, if we can get there. And I think that this is all about getting that vaccine so that way we can get back to normal, but we can get back to an improved lifestyle that we've all been hoping for. So just encourage all employers to continue to be that credible resource that their employees look to for information on what to do. And I know that we've been that resource over the last year. I just ask you to continue to be that resource for the next few months.
Thanks for that, Paul. We really appreciate it. We have gotten a couple of questions typed here into the chat. I'm first going to go to Zach and then Trisha. I know they're just trying to get a scope of what this maybe meant for employees who are vaccinated. So Zach, I think you mentioned a 40% of total workforce population. So if you want to just maybe describe that again and just give them an idea for what it looked like in terms of those who may have chosen the vaccine when you guys provided it.
Absolutely. So we have over 1,300 employees. I'm getting an accurate head count. So we've just went through a hiring a recent hiring push. As Paul said, business conditions are up, and we're in a fortunate position to be hiring right now. So just getting an accurate number, but right in the ballpark of 1,300 employees on site at the time of the event.
And so was it, you were saying approximately 40% chose to vaccinate through that, or at least
Correct.
through some method?
Correct. So, again, when it gets into the numbers, we made it, we also made it available. So I just got the numbers across. We're at like 1,490 employees presently. So there was also an opportunity for on-site contractors. So we were tracking those in the total number as well. We made it available to folks that are on-site every day, critical infrastructure that were suppliers in the area as well. So again, that's rolled up into that number. So great news is, I mean, we had really close to 500 total employees participate, employees and contractors that are on site every day. So.
Thank you. And then Trisha, same thing. I think you talked a little bit about what that uptake looked like for you guys.
Yep. So right now we're pushing 600 employees. During the event we had, somewhere, I think it was hard to get a number, but between 80, 95 people went to the clinic. But just through people reporting to us, we're guessing about, or estimating probably pretty close to 200 and maybe a little more of the 600, and people every day reporting that they've either got part of the shot or part of the vaccine, or their first appointment is scheduled. We still hope to have an on-site event, but we have about 600 employees right now.
Thank you. And then there was a follow-up question. You guys talked a little bit about policies. Are there any policies that you've adopted during COVID that you see continuing after return to normal, whatever that means for us and whenever that means for us? Trisha, I don't know if you've thought about that at all.
We haven't started talking about it yet, although, and maybe this isn't a policy so much as a practice, but this remote work has become very popular. And so I think we're going to try, seeing how we can continue with that.
And Zach, have you guys had that conversation either yet?
Yeah, so I did keep that section kind of short, but we've changed our mask policy several times. So we were wall to wall with masks. We were all based on community spread and kind of the feelings on the floor, and then again, kind of this long-term commitment to maintaining a healthy workplace, and what that looks like with a mask mandate as one example. But yeah, protocols on illness reporting, social distancing, the contact tracing, temperature screening. So all of those items are continued to be reviewed. But again, as we look at community spread and having the vaccine available and made available to our employees, it's provided us an opportunity to reflect back on those policies and see how we can open up when it makes sense. And so again, it's coming into the summer months. From a safety perspective, wearing a mask in a very hot environment, you're coming up against a health concern, against a heat stress concern, which is real in our environment. And so again, social distancing, I see that as the long term, and we've done some great things there and figured out that we can work. Similar comment on the work from home. We've got a population that certainly we've figured out that we can be very successful working from home, and so we are slowly having those discussions on what return to office looks like for us. But then also realizing that remote work is completely an option in some cases. So just the whole gamut there. I think the big piece is that we've become very dynamic in looking at these things as conditions change, and as our scenario has changed from the initial, what's the first step? Installing temperature screening, making everybody come in through one entrance. Those are the kind of things that we continue to talk about and reflect upon, and make sure that we're making the right decisions, with community spread being one of the primary drivers of that, watching that as we make changes.
Definitely. Thank you on that. We do have one question for our public health departments. And Nita, this might be more directed towards you. This was about proms and just, hearing ramblings in the community about parents renting space and, maybe across the river here in Iowa and having proms for kids and just worrying about spread and positive tests that might result.
Sure. So we've seen this throughout the pandemic where there are some different rules in Illinois versus in Iowa. So that really isn't surprising to hear. In Illinois, proms really are not allowed during the current phase we're in. We're not supposed to be gathering in those larger groups. And again, the rules a little bit different in Iowa. So I do know that some schools with parent sponsorship have reportedly, looked into having proms on the Iowa side of the river. It is still not recommended at this time in Illinois. And, we'll see what develops out of that. Hopefully we won't have any outbreaks to contend with in the next few weeks or so.
Yes, thank you. I don't see any additional questions, and just in reflection of our time, we're going to go ahead and conclude today's briefing. We're very grateful to Zach with John Deere and Trisha with Sears Manufacturing and Paul with the Quad Cities Chamber for joining us. We felt this was an important discussion to have right now as we're all trying to move forward at the same pace and get us to where we need to be. So thank you all for your time and for offering those words for us. The recording of this briefing today will be posted on our Facebook page as well as on our websites, and so they can be reviewed there if needed, and we will have our follow-up press release for our media partners. So thank you all for joining us. We look forward to talking with you again at the end or the middle of next week. So have everyone a great rest of your week and weekend, and we'll talk with you again soon. Thank you.